Welcome to Nutrition Rounds with Dr. Danielle Belardo, the podcast for anyone interested in learning about plant-based nutrition through an evidence-based approach. Every week, we share insights and interviews with physicians who are leading experts in nutrition and health. Whether you've been plant-based for many years or are still searching for the perfect diet, Nutrition Rounds will inspire and empower you to live your healthiest life backed by science. Now here's your host, Dr. Danielle Belardo, MD.
Today we are with one of my favorite physicians, Dr. Gemma Newman. She is a brilliant primary care provider across the pond in the UK who really believes in plant-based nutrition, utilizes it with her patients, and she's just an informative, wonderful, powerful force in this space. And I'm so honored to know her. So welcome, Dr. Newman.
Thank you, Danielle. That was a lovely intro. And I'm absolutely delighted to be with you.
So happy to have you here because today we are going to talk about the questions that I get all the time, and it's questions about women's health. And because you are a general practitioner, I'd love for you to just start out, kind of tell everyone about your path into medicine and how you found plant-based nutrition. And then, this entire episode is going to be answering a lot of questions about women's health that we get asked all the time. And I know you see this in your practice, and you take care of patients from all age ranges and all stages of life. So I think that it's going to be just so informative for our listeners. So starting with, where did you start in medicine, getting into plant-based diet, and just tell everyone a little bit about yourself.
Okay, well, I am, as you say, I'm a primary care physician, and I've been working in clinical practice for 15 years now. So it's been a long, long time. And I've been doing all sorts of specialties in that time. But my work in general practice has been for 11 years. And as you say, I see all sorts of people. And my passion for medicine has always been there. I've always wanted to be a doctor and help people and get to know them and their families. So it's been a dream realized, but I did find early on in my practice that I was getting increasingly frustrated because here in the UK, I'm a senior partner at a small friendly family practice. We've got nearly 3,000 people, but we only have 10 minutes per person. So I had to find ingenious ways of including nutrition and lifestyle information in that 10-minute paradigm, and managed to achieve it and get some incredible results for people. And it really did feel like I was suddenly able to add a lot more to my medical toolbox than I ever had before. And that journey was, it was a long process. I've always had an interest in lifestyle medicine, getting to the real root of what it is that has caused a disease, a condition, a symptom, rather than solely treating either symptomatology or the actual disease process itself. So it started early on with motivational interviewing techniques and solution-focused brief therapeutic approaches. And then when I went into the realms of aiming to give nutrition advice, I was more cautious to start with. Because I hadn't done much study in that area at that time, I knew that the general zeitgeist was carbs are bad and could cut those. But I didn't give that advice to my patients freely. I lost a lot of weight that way, but then what I discovered myself in my own health was that my lipid profiles raised despite weight loss and good exercise regimes, and I have a family history of heart disease. So, actually a few years ago I was even offered a book deal to talk about my own journey, but I declined because I didn't feel as though it was a good example to set for others when I was still struggling with a raised lipid profile. But fast forward a few years and I found the evidence around plant-based nutrition, and 10 years on with 2 kids and exercising less than half the amount, I managed to not only have a normal BMI but also bring my lipid profiles to the normal range. So I was absolutely delighted, and that really began my studying odyssey. So I've spent the last few years studying the ins and outs of plant-based nutrition, and being able to share that with my patients has been one of my absolute greatest joys. I've seen so many powerful transformations in people that it's truly made medicine not only my vocation, but like a huge passion. So it's been wonderful.
That is so admirable. And I just love that you shared that as part of your journey. I really do find that a lot of physicians who feel passionate about this found improvements in their own life through integrating plant-based nutrition into their own families and their own personal lives and their own health. And that's just a really beautiful story because it's just so interesting how your evolution of health evolved. You've tried different kinds of scope of diets and yourself and have tried.
Yeah, absolutely.
So fascinating.
And I have to say, I used to love steak. It was my favorite meal. And, I used to love eating all those kinds of foods. And so I try not to come at this with an evangelistic tone, but more of an I've been there tone. I really, really have.
And, it's actually so valuable. Actually, that's something I'm majorly lacking, actually, because I became vegetarian and then vegan. Like I stopped eating meat when I was like maybe 18 and then became vegan in my early 20s. So I never liked meat. So I do lack, it's not that I lack empathy. I'm incredibly empathetic and I truly believe everyone's on their own journey and I respect where everyone is with food and nutrition is so personal, but I do lack the, understanding of don't you just miss a steak because I never liked it. The funniest example ever is that recently there was a vegan meatball and I was eating it and I actually almost threw up because after a bite because I thought it was meat and everyone around me was like, how delusional are you that you haven't eaten meat in so long? This is not meat. But even the kind of texture consistency, it just makes me sick. And what's so important to recognize is that, people who did really like animal products, it actually gives you a level of understanding with your patients that it's not easy for everyone to drop it in a day. I actually think that adds a level of compassion and empathy to your practice that is so important.
Oh, thank you, Danielle. No, I do aim to come at this from a level of understanding, and people sometimes look at me a bit funny and say, "Oh, it's all right for you. You probably never even liked it." And sometimes I'll say, "Well, actually, it used to be my favorite thing, and I used to always order a burger, and or a steak." And what I have to do is I have to align myself with the information available, and then once I'd done that and realized the health benefits, then of course I allowed an appreciation of the other benefits to come into my consciousness, and especially obviously the environmental and animal compassion sides. It's all really a win-win, but yeah, I aim to really help people get it from their own health and what they can achieve personally.
That's so beautiful because I think your empathy and compassion, it comes through. We'll talk about where everyone can find you on social media later, but you can definitely you must follow Dr. Newman. Actually, just tell them right now where they can follow you. Follow you during the episode.
Okay, if you insist. So you can find me on Instagram. You can find me on Instagram at Plant Power Doctor. So that's my Instagram handle. And you can look at my website, gemmanewman.com.
And the reason why I say that is because, Gemma, one thing I love about you that you and I and a lot of other plant-based doctors share in common is this empathy. I think that understanding that all of our patients don't have to go 100% plant-based, but just being more plant predominant and plant forward is important. And, it opens up the realm of health and wellness to more people. It's more inclusive than it is exclusive. And I think that your social media really reflects that. It just reflects that this is a journey for everyone. And we're just here to support people on this journey. So I think your positivity is just really shines through. So everyone make sure, pause this right now and go to your Instagram app and follow Dr. Newman because I love what she shares. So
thank you.
Next up, I want to talk all about women's health because I get questions all the time about women's health. And I had Natalie Crawford, who's an OBGYN and fertility specialist, on for an episode. She's brilliant and wonderful. And, we can only hit on so much. And so I have so many leftover questions to talk to you about. And as you are a primary care provider and you're a female physician and you love women's health, I just am so excited to talk to you about of different ways that you've incorporated some integrative medicine, plant-based nutrition into your practice to help with different issues in women's health. So starting with one of the most common questions I've received is starting with even just premenstrual pain and menstrual cramps. Something that seems like for some people is not much of an issue, but for others, it's really, really, really debilitating. There's some different tricks of the trade that people can go about this naturally. So I'd love for you to touch on that.
Yeah, of course. And I do see a lot of women with period issues. And sometimes it can be really hard to manage, and it depends on the person. So I'd always ask them, what they're hoping, the different methods that they're looking at. But what's amazing is that there are certainly some natural remedies that can be potentially as effective as the drugs that we would usually turn to help with period pains. So for example, I do love turmeric. It's an incredible spice, and there was a study to show that the curcumin has an incredible ability to reduce period pains. It also increases BDNF levels in the bloodstream, brain-derived neurotrophic factor, which is a protein that is known to help with neurons survival and growth. And what's incredible is that it also is linked to reducing period pain. There was a randomized controlled trial, and what they did was they got women to take curcumin supplementation for 3 cycles versus a placebo supplement. And what they found was that in the women who took the curcumin supplement, there was a significant improvement in their mood, in their physical symptoms, and of course in their BDNF levels. And it didn't require very much. It just required a couple of capsules daily from 7 days before their period. And that's something that can be hugely effective. So just a really basic thing. You might know it's quite easy just to try and reach for the painkillers, and that can be the standard thing. But if you've got something that's natural that you can use, which can be as effective, then why not use it?
That's amazing, especially because it's so easy when you're young, when you're a woman in your 20s and 30s and you have cramps. It's so easy to just grab for a ton of Advil because Advil works, but it's at the same time, it's to think that there's an alternative method out there that has anti-inflammatory and pain reducing effects without the side effects of medication, even over-the-counter medications, is amazing. So that's just such a great tip.
Well, ginger as well. I mean, you mentioned over-the-counter medication. So ginger, there was a study on ginger, and they got 3 different cohorts of women, and they gave 1/3 of them capsules of ginger powder at 250 milligram dose, 4 times a day for 3 days from the first day of their period. And they gave the second one mefenamic acid, 250 milligrams, which, as you know, is a strong anti-inflammatory painkiller.
Yes.
Same dose. And they gave them 400 milligrams of ibuprofen in the 3rd cohort. Again, I think that was 3 times daily. So they were all given equivalent dosages. And what they discovered, I know it is a lot, different groups, and what they discovered was that they were all equally effective. So the ibuprofen was as effective as the mefenamic, effective as the capsules of ginger powder. So it's pretty amazing. And so if I've got a woman who's looking for a natural alternative, or even if she's not, I might just let her know that she could potentially combine turmeric with ginger and black pepper, because black pepper increases the absorption of turmeric, and they can combine them and maybe even have them maybe with hot water and lemon, and there you go, you've got a natural period pain relieving medication right there.
That is the best tip I've ever heard for that. And everyone that's listening, whoever has cramps ever, which is a lot of us, that's just an amazing tip, an easy thing to do. You just go to the grocery store, pick that up and give that a try. And also the anti-inflammatory effects of ginger and of turmeric affect your body systemically as well. I mean, so the effects are, they don't only multiply. So it's pretty much a win-win.
Absolutely. And you don't have to have it in just the root form. And I like to suggest that you can actually get the root itself and grate it into a drink, but you can actually get the ginger. You could get the ginger or the curcumin or the turmeric in powder form, in capsules, in teas, in tinctures. So it depends on what you like, really.
I actually put turmeric in the turmeric powder in my coffee, and I think it gives it a nice flavor. I actually particularly like it.
Yeah, well, there we go. That's another way of doing it when you're on your period. But vitamin D as well. The link between vitamin D and periods, because there are actually vitamin D receptors in the womb itself, and vitamin D is known to reduce prostaglandin production in the endometrial lining. If you make sure that your vitamin D levels are in the normal range, it may well improve your period pains. There was a double-blind placebo randomized controlled trial where they gave them a single high-dose shot of vitamin D, and it reduced period pains significantly. So again, it's worth looking at that. And generally speaking, plant-based diets really do seem to help. which a lot of women anecdotally have told me, and I've experienced myself. And there was a study to show that a 2-month plant-based diet increased the levels of serum SHBG, which is corresponding to a reduced risk of PCOS as well. So therefore, not only are you potentially improving your period pains with a plant-based diet, but if you are suffering from PCOS, it may also improve your fertility issues and reduce potentially also menopausal symptoms as well. I've got an incredible patient story that I can share with you if you are interested to talk about.
Love that.
Plant-based diets can improve. Yeah, because, us women, we have it tough, don't we? We've got periods, we've got menopausal symptoms.
No, you're so right. So women, we have it tough. You start out with your period when you're 13, and then you have to deal with cramps, then you have to deal with pregnancy, then you have to deal with perimenopause, then you have to deal with menopause. It's like, it's like never
awful. I know. She came to me and she was in absolute distress. She didn't know what to do. She was living a healthy lifestyle. She was really desperate. And I said, what's going on? She was having horrific blooding. She was having flushes. She was having night sweats. Her periods were also causing clotting and severe pain. They were more frequent, not less. She was 48.
Oh, okay. So right in that age range. Gotcha.
Right in that age range where the periods are starting to become more frequent, and she's exhausted because of the night sweats and the insomnia. She was suffering from depression. And I thought to myself, what can I do? And she said, look, I'm getting 2 weeks of hell every month. And we talked things through, and I realized that she was already pretty healthy, and she was definitely not keen to go down the route of certain medications that I was offering her. So I thought, well, could a few simple changes really make a difference? And, as we've discussed, we know that turmeric is as effective as anti-inflammatories for period pain relief in some studies, and soy products daily are powerful for combating hormonal flushes. And again, there's information to suggest that animal products and fatty junk food increase the amount of inflammatory prostaglandins that are produced by the endometrial cells. And this is the arachidonic acid content of these foods, which then leads to the muscle contractions and the blood clotting and the pain. And we know that whole food plant-based diets are really good for grabbing onto excess hormones and recycling them. What's amazing is that fiber in our foods lowers circulating estrogen by reducing beta-glucuronidase activity in the feces, and that leads to decreased reabsorption of the estrogen in the colon. And also, fiber also binds directly to estrogen in the intestine, increasing its excretion. Yeah, so I tried to explain this to her in the most simple way. She looked at me with this glimmer of hope in her eyes, and we were both hopeful that this could be a way forward for her. But I didn't see her again for several months, and as it is in the NHS, you don't necessarily have the time for more personalised follow-up. But I thought of her often over the months and thought, I wonder how she got on. And then fast forward to 10 months later when she came to see me, and she looked like a different woman. She came in with a beaming smile on her face. She'd lost 10 pounds in weight. She was having no period pains whatsoever. She was having no flushes at all. She was sleeping through the night. Her friends said that she looked 10 years younger, and her eyes were and her eyes were less puffy. That's a complete anecdote, but she was telling me my eyes are so
probably
clear and sparkling.
If she's getting sleep now, and if she's like feeling decreased inflammation, it makes sense.
Absolutely. So she came to me to tell me really that this had changed her life, and she was over the moon. And of course then she was so enthusiastic. She'd been telling all her friends about it, and it's just so wonderful to see these kinds of improvements. And of course it doesn't happen for everyone. Some patients will find, okay, well, my periods are a bit better, or my flushes have improved by 50% or 40%, but it's something, and you can see that the mechanisms are there to show those improvements. So it's really worth letting everybody know, I think.
That is such a beautiful story. I love hearing that because, me and you have talked a lot before. We both love research. We love, randomized control trials. We love powerful data, but at the same time, even N of 1s, N of 5s in your own practice means so much. They're so meaningful to how you treat patients because you can't unlearn it, unsee it. And when you have a patient that does really well, it's just, especially doing something that, plant-based nutrition is one of those things that isn't just going to help one organ system. It's not going to help just one symptom. It's going to help everything in your body. So that's why it's such a beautiful way to integrate lifestyle into medical practice for even just one specific symptom or for a constellation of symptoms. That's
absolutely. Yeah. And women don't need to be too concerned as well, because I think I've had a lot of women coming to me and saying, well, what about soy?
Gemma, you literally read my mind. I was just about to say to you, can you please clarify soy? Because, I've posted a lot about soy being healthy on social media, but it really does. It's one of those questions that I still get probably at least a couple times a week. Would you clarify the healthfulness of soy in women and the rumors about soy with breast cancer and things like that?
Yeah, I would always recommend to women to go for soy that's least processed as possible. Edamame beans are fantastic, and I really like things like miso and tempeh, tofu as well. The soy products that are more processed and from fake meats are not so beneficial, I would say, because they have their own health issues potentially. But soy is known to be good for hormonal flushes. It actually helps to potentially reduce the breast cancer risk. The reason that people get so confused about it is because it's known to be a phytoestrogen, which is a plant-based sort of form of estrogen, if you like, but it's far less bioactive than mammalian estrogen that you'll get from certain forms of HRT or combined pills, or of course cow's milk. And the interesting thing about it is that it's a selective estrogen receptor modulator, a SERM, and there are different kinds of estrogen receptors in our body, and the alpha estrogen receptors are contained in the breast and the womb and the liver, which is why if you have a mammalian equivalent estrogen, it's more likely to bind to tissues in the breast, increasing risk of breast cancer, binding to tissues in the womb, increasing risk of endometrial cancer. It's more associated with prostate cancer, and of course binding to the liver, which increases the risk of things like blood clotting. Whereas if you have something that is binding preferentially to the beta receptors, these are contained primarily in the bone. So when you consume soy products, what they do is they bind preferentially to these beta estrogen receptors, thereby potentially also having a role to play in bone health, as well as reducing risk of these hormone-dependent cancers. So it's pretty special. I think you have to take each person as an individual. So, for example, there may be some people with Hashimoto's disease or other thyroid issues that may have some issues with soy products. But on the whole, if you're generally otherwise very well, I can't see any problems with it. And in fact, the benefits of it are pretty tremendous for most people.
Tremendous. That's such a great way to put it, because it really does help so much. So do you find that your patients that are perimenopausal, that increasing their soy intake does help alleviate symptoms?
Yes, I do. And also, with regard to bone health, again, there's a lot of confusion, because people are worried that if they don't consume dairy, then they'll get fractures and things like that. There's not really a lot of evidence. They've failed to find an association with increased dairy consumption and increased bone mineral density. And in actual fact, some studies have shown a negative association, and that might be something to sort of be aware of, that actually potentially the more dairy you consume, the more likely you are to potentially have a fracture. And there was a randomized control study on 3 cohorts of women, which I think is really interesting. These are all perimenopausal women, and they were monitored for 2 years, and they were basically monitored for their bone health. And a third of them were a control group where nothing was done. A third of them were provided with progesterone creams for menopausal symptoms, and a third were provided with 2 cups of soy milk. And as they followed these women up over a couple of years, what they found was that the control group had a gradual reduction in their bone mineral density, which is what you might expect over time. And the progesterone cream group had less of a reduction in bone mineral density, which is absolutely fantastic. But the group that had 2 cups of soy milk daily actually had an increase in their bone mineral density over the 2 years of the study period. So not only are we facing the idea that it can reduce flushing, but it can also potentially also improve that bone strength. So we can see that there are some pretty good benefits from potentially having soy products, and also just reducing the amount of refined sugars and animal products in the diet, because again, they can be associated with increased hormonal activity.
That's so interesting. Well, sticking with women's health and with hormonal issues, one thing I wanted to touch on that you are actually doing a program with the Happy Pair you're discussing how plant-based nutrition and how lifestyle modification can help with acne. And plenty of women struggle with hormonal acne, and they're constantly asking me about it. So I would love for you to kind of explain the work you're doing in this and how you've helped patients.
Absolutely. And it's also something close to my own heart because my mum suffered terribly from cystic acne when she was in her teens, 20s, 30s, and now she suffers from rosacea, and it really affected her life and her well-being. And it's amazing how psychological it can be, because people can sort of take a look at your face and decide, well, that's a reflection of your internal health, or they'll make a judgment about you, which can really, really affect your self-confidence. So this is something I'm hugely passionate about. And also I myself, sometimes I even struggle with breakouts. And I've seen with my patients firsthand, the psychological effects of acne can be absolutely devastating. And it's really upsetting to me when I hear teenagers come and see me and they've been told by other people that you'll just grow out of it, because it's something that can be so damaging. So I'd say that if you do suffer from acne, then don't be afraid to go to your doctor sooner rather than later. Yes. There are many amazing treatments now available. But basically, acne develops when, dead skin cells and your skin's natural oils block the hair follicles in your skin. And then bacteria enter those blocked follicles and they start to multiply. And then when your immune cells try to defend themselves against the bacteria, it could cause redness, swelling and spots. And that's the etiology of it. But it's also associated with your hormones, with your stress levels. Stress can be a huge instigator of acne in people with oily skin, or just who are prone to spots. And diet does play a role. For a long, long time, we were told that it didn't.
Right. Actually, it's so funny you say that, because I feel like the most long-standing rumor in all skincare has been for so long that what you eat does not matter. We've had there's no research that's been definitively showing eating X, Y, or Z affects your skin. But I've noticed personally, and I know plenty of my friends have noticed, depending on the way I'm eating, it definitely affects my skin.
Yeah, no, it really can make a huge difference for some people. And of course, others will have the perfect diet and still suffer. Food choices can play a huge role. And I mean, if we think about food choices, meat products, milk, cheese, butter, they're not just foods. They're also, they're powerful stimulators of the TOR enzyme pathway. And overstimulation of this pathway is a problem because, well, for example, with dairy, cow's milk is designed for calves, and cow infants grow nearly 40 times faster than human infants. And cow's milk, it has 3 times more leucine than human milk, which is one of the primary activators of the TOR pathway. And leucine, which is an amino acid that's essential, but in excess can also increase cellular aging. And that's, the work of Professor Voltalongo has shown us that that's the case.
Right.
And so when we have this overactivated TOR signaling in adulthood, it can pave the way for more chronic diseases. That, a history of acne has been associated with breast cancer risk in women, for example, and prostate cancer in men. And
that actually makes sense, because if you think of the inflammatory pathways, every podcast episode I do focuses on even though I'm interviewing different specialists in different fields, what it always comes down to is that it is not, our organ systems do not live independently. Everything is connected. So I didn't know that about acne and breast cancer, but it makes sense, as inflammation is the root of so much disease. It makes sense systemically, and actually even many dermatologists, and we're going to have a dermatologist on the show to talk about all different kinds of diseases, but especially acne, and not for everyone, but for dermatological disease in general, it's actually an example of kind of what's happening in the rest of your body. Sometimes it's erupting in your skin. We see that with autoimmune disease and different things. So it's really fascinating, that link you said with regards to cancers and acne, because there's another link as well, which I forgot to mention, is of course IGF-1. I mean, we know that animal products cause us to produce more insulin-like growth factor, which increases sebum production in the skin, which is then again potentially increasing our risk of other chronic diseases. So Dr. Longo's done a lot of work in the mTOR IGF-1 space with regards to animal protein, kind of stimulating that and showing that it increases both. So
it does. And sugar too, I've got to say, sugar is refined sugar. It causes inflammation. And chocolate, I hate to say this, but chocolate.
Is there any
specifically, I know it's awful. Specifically for acne, though,
is there any chocolate that's safe, like that's anti-inflammatory?
Well, there are. I mean, obviously, there are polyphenols in cacao, which is really great for other reasons, but it seems that even dark chocolate and there was a study on cocoa powder, and there was a blinded placebo-controlled trial where people were given cocoa powder in capsule form, and it still seems to lead to acne outbreaks, even when people didn't know that that's what they were having.
Oh my God!
Sorry.
Everyone listening, I'm so sorry.
Forget that one, but I just thought I'd let you know. And greasy foods are going to increase sebum production, but we've got to think of the things that can improve it. So eating more fruits and vegetables, you've got the antioxidants, the nutrients, the fiber, things like oranges and lemons contain the vitamin C, which your skin thrives on. Tomatoes contain the lycopene. Sweet potatoes got the beta carotene. You've got the leafy greens and yellow veggies from the lutein, which is great for your skin. Spinach and avocado contain vitamin E, which is great for your skin. So the bigger variety of fruits and veggies, the better for your skin. I think, if you have severe and stubborn acne, certain doctors, for example, Dr. John McDougall and Dr. Neil Bernard, they will advocate for an approach where you have a very low fat intake, which essentially would eliminate all fats probably for about 6 to 12 weeks.
I'm curious about this just because, as you know, I've been dabbling a lot into plant-based as I'm studying for my lipid boards and my cardiology boards and everything. I've delved a lot into plant-based fats, and I'm wondering if the same thing holds for healthy unsaturated fatty acids like polyunsaturated and monounsaturated, like if we're talking avocado and walnuts and all these things, because
we know that they're healthy fats and that we shouldn't. The average person should not be limiting these things.
Right. Sure. But I'm curious if it does affect acne or if it's mostly the saturated fat that we see with, that leads to more insulin resistance and things like that.
Yeah, well, I would say saturated fat is more of a culprit because that increases insulin resistance in the cell, and it also has a link to PCOS. Having said that, this is pure anecdote. So again, I can't speak from study experience on this point, I should say, but when I was doing research around acne, I read the Clear Skin Diet by those two twin YouTubers. I can't remember their names now, but perhaps we can add that at the end. And they speak with lots of people on their online courses, and they say that even certain things that you wouldn't really expect could potentially flare things up for certain people. Like, for example, vitamin B12 supplement is an absolute must if you're having a whole foods plant-based diet and if you're vegan as well. But what they said is that in some people, vitamin B12 supplementation can actually change the way the microbes on your skin react and can potentially cause acne flare-ups in some very susceptible individuals. So in their program, they suggest that people get their vitamin B12 levels checked. And if they're going for an intense program of fat reduction, then they could also potentially cut back on their B12 supplementation if their levels are normal.
That's so interesting. What's the mechanism of that? How does B12?
Yeah, well, apparently they think it's something to do with the way the B12 interacts with the microbes on the skin. But when we're born, we don't have any of these microbes. They have to start to develop over time. And the acid mantle of the skin, which protects the skin, is predominantly made up of the healthy biome on our skin surface. And it could be an imbalance of that skin biome in very susceptible individuals that could play a part. And other people even could be susceptible to breakout from something as simple as a capsule with oil in it. This is an extreme case. Most people in most circumstances would simply find that a basic whole food plant-based diet, which is replete in omega-3 and healthy omega-6 fatty acids, would absolutely be 100% fine. When we're talking about people with severe recalcitrant acne who have tried everything, this particular program suggests doing that. But again, that's more of a niche advice. I'd say for the most part, most people will respond very well to a basic whole food plant-based approach.
Amazing. And I do also love that you point out too, I think it's so important that and I know you also emphasize this on your social media, a big part of the amount of large empathy you have for patients all across the spectrum is that even if you follow the cleanest, most perfect whole food plant-based diet, you may still struggle with acne. And
absolutely. And sometimes the stress also. So some people can get so fixated with what they put in their mouth, the extra stress that they've got also potentially causes spots to get worse sometimes.
Exactly. And, diet is one part of our lives, and it's one important part, but it's one part. There's also environment, there's stress, there's hormones, there's all these other factors. So I definitely would say for anyone that's struggling with acne, if you don't find success on a plant-based diet, it doesn't mean you need to not eat a plant-based diet. If anything, a plant-based diet is only going to help you, but there's also medical options, of course, by seeing
absolutely
your physician, your dermatologist. You don't have to suffer with acne.
No, please don't think I have to just suffer on my own and I'm going to keep going with this diet and that's the only thing that can help. No, there's so much that can help.
So much that can help. And the most important thing is getting in. I know my friends that are dermatologists and primary care providers, the most important thing is that getting in as soon as you can, to start working with the doctor, because there's so many options now.
Yeah, there are. And also there are other lifestyle things that you may not have thought of, like late nights, alcohol, coffee, lack of sleep, even like your contraceptive pill, or if you're a bodybuilder and you're taking, any kind of whey powder, like things that you may not have even considered, so it's definitely worth just having a review and going to see your primary care provider or your dermatologist to talk things through, and also, consider the medical options available.
Absolutely. And one thing linking into this that I want to discuss is PCOS, because a lot of women that are my age in their 20s and 30s are that struggle with PCOS. I have a few patients that have PCOS that have improved significantly on a whole food plant-based diet, but it really does tie into acne and all of the hormonal issues you've been discussing. So I'd love for you to kind of go into how nutrition and how lifestyle modification can be really life-changing.
Yeah, absolutely. PCOS, having irregular periods, it's awful, especially if you're thinking about trying to start a family.
And also I have to chime in from the cardiology perspective. I've seen patients with PCOS that, I'm 32 years old, but I've seen patients with PCOS that are around my age that have so many markers for metabolic syndrome already, and put themselves at higher cardiovascular risk because of this. And it's not your fault, but there are things we can do through lifestyle to help mitigate these risks. And I think it's so important to talk about.
Yeah. And so increasing fiber content is probably the number one thing that you can do, because that will help you reduce the recycling of your estrogens in the body. Avoiding high GI foods like refined grains and fizzy drinks and added sugars will be hugely helpful. 40 to 60% of women with PCOS are overweight, and weight loss does tend to help, especially it helps to regulate the periods. And it also means that we get less potential hormone disruptors in our body. So there's a correlation with, for example, when you're having meat products and fish, they tend to contain PCBs, dioxins, other toxins from the ocean that have bioaccumulated in the fish. Well, these are endocrine disruptors. And when you look at the internal abdominal fat, there does seem to be in some studies a correlation between the increased levels of PCBs in the fat that you're storing and increased fibroids in the body as well. And potentially also when you have PCOS, there was one study that showed that you do actually have more receptors for the advanced glycation end products that are contained in these foods, especially when you're cooking certain foods like processed meats, red meats. In fact, any cooking of meat will cause the release of advanced glycation end products. But specifically, if you're barbecuing it, then that could also play a part. It's important to look at all these different things that people may not have even thought of that might improve their clinical condition. And these, beef, pork, chicken, cheese, butter, they processed junk foods, these all contain these advanced glycation end products. And if you reduce the amount in your diet and you have more fruits, vegetables, whole grains and beans, then you hopefully will improve PCOS as well as things like fibroids and period issues.
That's fascinating. So really the same diet can help to target multiple issues. And, women with insulin resistance often struggle with acne because it's one of the portions of the disruption that happens with their hormones.
Yeah, absolutely. And it's the same, like I said, with it makes sense that if you're having a fibroids, for example, it's a similar principle to estrogen responsive malignant tumors. You're fueling the growth of a benign tumor essentially. And when one study showed that fibroid tumors are associated with increased consumption of things like beef and ham, and people who have animal product predominant diet tend to also start their periods about 6 months earlier. And if you start your periods when you're less than 11, you have an increased risk of fibroids. So you can see how all these correlations begin to fit together.
That's so interesting.
Yeah, it is. It is interesting. And again, like going back to the hormone disruptors, the phthalates, these are also endocrine disrupting. Plastics may be linked to endometriosis. So UK data would suggest that fish contains the highest levels of phthalates, but I think in the US it's highest in chicken and therefore in their eggs as well. And in milk, it potentially is there from the tubing that's used to get the milk from the machines that are used. So you can see how all these different things begin to link together. And if you're aiming to eat low in the food chain, eat fresh, whole, unprocessed foods, it's going to be better for a number of reasons. And
if you don't mind just touching on endometriosis, for those who don't know or aren't familiar with exactly what it is, kind of what you can expect symptom-wise and when people see it, because it's interesting that also can possibly be improved with changes in diet.
Yeah, endometriosis is a tough one. Many people are left undiagnosed for years and they're just told, oh, you've just got bad period pain. It's really sad, but basically what happens with endometriosis is that as your womb lining sheds every month, rather than just having parts of the endometrium that are coming, producing these your period blood, you've also got patches of endometrial cells in other parts of the pelvis typically, but it can occur and migrate to any part of the body. Some unfortunate cases have been found where you get endometrial lining tissue in the lungs, and that also can bleed every month with all the hormonal surges that take place. The tissues that are in the womb can also bleed in other parts of the pelvis and the body, leading to irritation, inflammation, and more severe symptoms. And what you tend to find is that the main issue is severe period cramps and dysfunction, but you can also, in addition to that, get things that women are sometimes afraid to talk about, like painful sex. And you might find on physical examination that these poor women, they've got almost a slight sort of stiff area at the back of the vagina, near the os, because of the increased bleeding every month. It can lead to adhesions, and it can be tremendously painful. And the gold standard for diagnosing that is a laparoscopy. Okay. So it's not something that you can just usually diagnose through the history, but doctors need to be vigilant that if somebody's got such crippling period pains that it's taking over their lives, then endometriosis may well be the potential diagnosis.
So important. Thank you so much for explaining that so well, because a lot of this can be confusing, and depending on, especially for a lot of my listeners who are younger females that, maybe in moving cities and changing, especially if you're seeing different doctors every 3 years for your OBGYN follow-up or every year, your history may not necessarily follow with you. So it is important for women listening to just kind of be cognizant of that. If they're experiencing any of these symptoms, to bring it up with either their primary or their GYN.
Absolutely. And this is interesting as well, because oftentimes women are given hormonal medications to control symptoms. That can sometimes mask endometriosis. So
you're talking like OCPs, essentially?
Yeah, OCPs, yeah.
So Gemma, I also wanted to ask you about, for these perimenopausal, postmenopausal patients, a big hot topic that a lot of women are curious about is hormone replacement therapy. And I think it's such an important option to discuss in addition to nutrition, because, I see patients from a cardiovascular standpoint where I don't do anything in this space, and I feel almost helpless because they're really tortured by a lot of symptoms when they're going through these changes. So I'd love you to discuss this. Yeah.
Absolutely. And as I said, there are medical therapies that can help with that. And I do prescribe hormone replacement therapies for women, but it has to be on a case-by-case basis. I always like to take the person as an individual and help to educate them on the pros and cons. So, there has been some recent drama from a Lancet analysis, which was a it wasn't really any new research, but it was a bit of new number crunching, which was looking at 108,000 women, 58 studies involved, and they found that there were 1 million extra cases of breast cancer since 1990 that they attributed to HRT. And so there was a lot of panic around that. But breast cancer is a complex disease. There are lots of factors involved. And so, yes, it is important to let women know that there is an increased risk of breast cancer with a combined oral contraceptive pill. But the risk is probably, this risk increase, I think, is about 2.6% over 5 years, whereas women are perhaps told that drinking alcohol can increase risk of breast cancer. Not exercising can increase the risk. Being obese increases the risk by about 8% over 5 years.
So it's a benefit versus risk analysis. If you have a perfectly healthy patient that's really suffering from perimenopausal symptoms,
Yeah. Well, this is the thing, is you have to try. It's always a bit of a balancing game. As a physician, you've got your patient's best interest at heart, and you want to know what they want from your consultation. And I've found that certainly for women with premature ovarian insufficiency, it's absolutely vital to have hormone replacement therapy. They'll have, it does provide some cardiovascular and brain protection and reduces risk of bowel cancer and osteoporosis risk. And, even some women can be suicidal without it. It's awful. When you have a surgical removal of the womb and ovaries, or you have premature ovarian failure, this can be absolutely suddenly putting you into a hormonal abyss, quite frankly, which can be really difficult to deal with without the use of these medical interventions. But it is individual choice, and I would say that there are downsides to HRT, and there are downsides to the oral contraceptives. And us poor women, we take it on our bodies to sort of help to regulate our fertility and all of these things, but there are pros and cons even with the oral contraceptives that we take. Yeah, absolutely.
Of course, I think you and I are on the same page, and that we're very, very, very pro lifestyle medicine, plant-based nutrition, and we both also share the same positivity towards the advancements that have been made in medicine and medical therapy. And so I think that is the best balance. I think a lot of the doctors I really respect in this space, you and my friends like Michelle McMacken and Rob Oswell, Mauricio Gonzalez, Garth Davis, we all agree that plant-based nutrition is so important, but that medicine also has a really important place. And I've recently been asked actually by a lot of women, I did a Q&A on my Instagram, and a lot of women actually messaged me about OCP saying, they're not vegan, what should I do? And I said, listen, I personally have been on OCPs for really long time. And, I think that with every study that we see, there are some risks. There's also, of course, some benefits. If you've been on an OCP for an extended period of time, you have lesser risk of certain GYN cancers, more risk of others, et cetera. But at the same time, there are non-hormonal options like a copper IUD, things like that people can choose.
It's tough. I think it's so tough being a woman. I absolutely, totally agree with you. The oral contraceptive pill, it can reduce the risk of ovarian, uterine cancers and colorectal cancers potentially. It provides period pain relief, and it can relieve cyclical mood symptoms, and it can sometimes resolve acne. But the downside is that it can potentially cause nutrient depletion. It can potentially increase the risk of breast and liver cancers, gallstones, intestinal permeability, maybe even reduce libido in some women. It can disrupt your HPA. Well, obviously, it works to disrupt your HPA axis, and so we have to consider that there are pros and cons. And clotting risk, I almost forgot to say, of course,
right.
If you're over the age of 35, you're a smoker, you're obese, you've got high blood pressure, this really is not the best choice.
Totally.
So, and then, the thyroid as well, it can potentially increase thyroid globulin, which prevents thyroid hormone use in the body sometimes. So it's a real balancing act, I would say. And
as you're rattling this off, I've been on OCPs I've been on OCPs for 12 years. So it
might be time.
Thanks for reading me the package insert, Gemma.
sorry. This is we don't look at the package, do we?
But being a woman is tough, and you have to really just discuss, like, I love your transparency. You just have to discuss with your doctor. And this is what I told women on social media, is that you can't, not one thing is going to work or be perfect for everyone. I have a friend who swears by a copper IUD. She couldn't do hormonal birth control ever, loves a copper IUD. You have to discuss with your physician. And there's no reason to feel like you have to go at this alone. You have to partner with a doctor like Dr. Newman, who will give you the true rundown and give you the risks, benefits, and find something that works for you. And I think it's also important to note that not everyone does great on the same pill too, because they all have different formulations.
Yeah, they do. And some of them increase risk of thromboembolism. Some of them are given to help reduce acne. Some of them can really affect the mood. I've had so many women say to me, I just cannot take this pill. It's really affected my state of mind. And I believe them, because
right.
a lot of doctors would just say, oh, it's probably not the pill. But no, I've seen it enough, and I know the literature well enough to think, no, there is actually a risk there of mood symptoms. So we have to take people on a case-by-case basis. And I encourage women to understand the pros and cons before they make their choice.
Absolutely. Well, thank you so much for discussing. It's been a full hour of all women's health, and this has been so valuable. Besides the fact that you scared me about birth control that I've been off. I'm just kidding, guys. I love OCPs. I'm very pro OCP. So, then again, that's for me and for many of my friends. We're doctors, and a lot of us have been on OCPs for a while, and we think they're great. But then again, I have friends that have, like you said, done different methods or IUD, et cetera. So I think that it's very case by case, but you've been just so wonderful. I can't thank you enough for really, really just providing the most clear and easy to understand way how women through each stage of life can kind of use lifestyle and other sort of integrative medicine techniques to optimize their health, because women's health is so important. And I think a lot of times things like your period and things like going through cramps and then, escalating up to when you're going through perimenopause, these are things that women don't necessarily feel like they should be talking about, which is ridiculous, because 50% of this world is female and deals with this.
Yeah, so I think we should all be talking about this.
You're right, exactly. And so
it affects all of us. So 50% of the women are, can be affected, and 50% of the men have to live with the women. So yeah. we should all be talking about it.
That is so perfectly said. Actually, if anything, if any men are listening to this, you should be paying extra attention. And if your girlfriend,
oh my God, I cannot imagine very many men getting to the end of this podcast.
No, I have some dedicated listeners.
Kudos to you if you have.
If you're a man and you've made it to the end of this episode, tag me and Gemma on social media, and we will give you very special shout outs, because I give you so much credit for making it to the end. But also, if you're a man and you made it to the end of this episode, and your mom or your sister or your friend or your wife or your girlfriend has any symptoms like this, especially period pain, things like that, feel free now to recommend turmeric and ginger, because now they
will thank you forever.
They will thank you.
Frank, I talk about this with my sons. They're only young, but I'm talking to them about things like periods and life. Men need to know this stuff as well.
And men need to know. And now it's 2019. Like, it's not like now 50% of women, at least in the United States, 50% of medical students are female. So plenty of emerging doctors are women. And so we're bringing this into the forefront of medicine. We're talking about women's health, and it's so, so, so important. And so I can't thank you enough for just being so wonderful. And also, I want to thank you for teaching me the turmeric and ginger thing I did not know about. So I just can't thank you enough. You're the best. And please tell everyone where they can find you again on all of your social, in case they missed it before.
Oh, you're so kind, Danielle. And I just also want to say thank you for what you do. I have been so impressed with
so sweet.
It's true, your podcast, your social media, all of your work in cardiology. You are an incredible woman.
Oh, you're so sweet. Well, us women, we got to stick together,
Absolutely. So, it's Instagram at plantpowerdoctor, and it's my website is gemmanewman.com. I'm also
anything big coming up that you want to share for anyone to look out for?
Absolutely. I am very, very excited. We have one of the world's best international plant-based nutrition conferences being hosted in London next month.
Next month. Oh my gosh.
Yeah, we have VegMed, and it's going to be huge. We've got, I believe, Dr. Gregor, Dr. Bernard, myself.
Oh my gosh, congrats.
Yeah, we've got Dr. Alan Desmond, we've got Dr. Shireen Kassam, plant-based health professionals in the UK, and we've got some fabulous international speakers. I cannot wait. That's going to be October the 12th and 13th in London.
Can people still get tickets for that? If
people can still get tickets for that.
Where do they go?
The public day is on the Sunday, I believe, and then the health professionals day is on the Saturday. So if you just look up VegMed Conference London, it should come up. Other than that, we've got, what have I got coming up? There's a fantastic new plant-based nutrition course run by Winchester University, which I've created some content for. That's going to be fantastic. So if anyone's got a passion for learning more about plant-based nutrition, they can sign up for this amazing online course run by Winchester University, and they can hear all about all the different health aspects of plant-based nutrition.
That is perfect. Thank you so much, Gemma. Thanks for joining us.
My pleasure.